Senator Rosen.
Thank you, Madam Chair. And thank you, Senator Murkowski, for holding this really important hearing today, and of course for the witnesses for being here. I want to build on what Senator Smith was talking about, because it is important that we equip schools with the comprehensive mental health and suicide prevention resources we know are so critical, because not just Senator Smith, but we've heard from everyone this morning, schools, our students, we're just facing such a growing mental health crisis. And the American Academy of Pediatrics, they recently declared a national state of emergency in children's mental health. And in Nevada's Clark County School District, we've tragically lost 20 students to suicide since the onset of the pandemic in 2020. His families will never be the same. And so we must do more to keep our students safe, to promote their mental health and their well-being, which is why, as Senator Murkowski noted earlier, I'm working with her on bipartisan legislation to help provide additional resources to support K through 12 mental health. And currently the Substance Abuse Mental Health Services Administration, or SAMHSA for short, does not have the authority to provide funding assistance directly to school districts to promote comprehensive health and suicide prevention services. So Dr. Prinstein, given the current mental health crisis in our schools, could legislation authorizing SAMHSA to directly provide targeted and timely resources to K through 12 schools help prevent the mental health challenges before they occur, and of course address suicide attempts and prevent the suicide from taking place?
Yes, Senator Rosen, thank you so much. Hooray. This is a great step and very, very important. The opportunity to make sure that schools themselves can use their local expertise and their knowledge of what their community needs is a fantastic idea. I will say, please do keep in mind that school staff are currently overwhelmed and usually turning to psychology and as well as other mental health care providers to teach them about the skills that are needed. Psychologists often do this just out of the goodness of their own heart. There's no reimbursement mechanism. So as this starts to become hopefully a far more widespread practice of schools instituting preventive programs throughout entire communities, please do think about ways that psychologists and other mental health care providers can be as helpful and dedicate as much time as possible to help teach the school staff what's needed, to use our evidence-based assessments to screen for risk, and to use our evidence-based interventions so we can help as many people as possible. We have many prevention programs ready to deploy, and this is a very exciting opportunity that you're speaking of. Thank you.
Well, you set me up perfectly for my next question, because all 17 counties in Nevada are designated as health professional shortage areas. And so it's why I'm really proud of the work being done by University of Nevada, Reno. The master's level students, they're providing mental health counseling services to K through 12 students in nearby Churchill County, and hopefully doing some of that other training when they're in the schools that you speak of. And this partnership allows our UNR interns to gain real world experience in a supervised setting, while also increasing the access and just the knowledge base for everyone in those schools, particularly right now in Churchill K through 12 students. So again, Dr. Prinstein, this is a model, we're using it in Nevada. How might this model or others that you see, not just in Nevada, how can we lead the way in helping to promote these kinds of partnerships that will address the burnout, the critical shortages, and give those benefits to the students and teachers as well, counselors?
I think it would be terrific if we had the workforce to be able to do that in all states. Imagine that there were school psychologists enough to deploy and consult with every school out there, not just one per school district or one per county, sometimes with kids waiting for years before they're able to get an evaluation. Meanwhile, their parents watch them failing grades and experiencing difficulties, just waiting for that school psychologist to join in. There is sometimes only one mental health care provider for an entire county or for a 100-mile radius, which makes it very hard to consult with all the school districts that ask us to really play a role in just the way that you're describing. So I think that this approach, coupled with a substantial increase in the workforce, could really be a wonderful model for us to try and change the way that we're thinking about mental health from a prevention approach as well as an intervention approach.
Well, thank you. I appreciate that, and I look forward to working with all of you and my colleagues to promote workforce training in the mental health space. We really need it in so many areas. Thank you, Madam Chair.